This is how a female pelvis looks like. It has this large bone which is called as innominate bone. There is this sacrum. This one little tiny thing is called as coccyx. This little thing is called as coccyx. And this innominate bone is actually a fused bone. If we look closely, this innominate bone has three parts. It has got ilium, it has got ischium. If we see it from behind, let me show you. So this portion which we saw is ilium, and the same bone, if we go behind, is called as ischium. This is the ischial tuberosity and the pubic bone. So it has, basically it's a fused bone. See, it has got ilium, ischium and pubis. Okay, these are the pubic rami. This is the pubic rami. So the pelvis is broadly divided into 4 varieties, depending on what is the shape of the inlet. So this is how, just so if you have to see the shape, this is how the shape looks like. You can see it looks like a heart shaped. This is the sacral promontory, and if you trace the upper inlet of the pelvis, it is heart shaped. So this is gynecoid pelvis, which is the commonest variety of pelvis seen. So it is basically divided into 4 parts depending on the shape of the pelvis. So if we get to see, let me show you. If it is heart in shape, the inlet, the upper border, if it is heart in shape, which is the commonest, it is called as gynecoid. In case this is broadened like this, something, the shape would look something like this, it is called as platypoid. Easy to remember, platypoid. It is a transversely long. Then this is android, and android is basically male variety. So if the posterior portion is broader and anterior is narrower, if this posterior portion is broad but anteriorly it becomes like a triangle, then it is an android pelvis. And the last one is the, you can see, anthropoid. It is oblong antero-posteriorly. So it looks more like an oval shape antero-posteriorly. So if it is antero-posteriorly oval, it is called as anthropoid. So quick revision: heart-shaped, the commonest, gynecoid; transversely flat, platypoid; triangular, android, it's male, androgen, android; and antero-posteriorly, if it is oval, it is called as anthropoid. Alright, and all these shapes are dependent on the upper border or the brim, the shape of the brim, not of the cavity. Pelvis is usually divided into inlet, the mid cavity and the outlet. It is very important to understand this pelvis because the labor or the process of delivery, it plays a major role in delivering the baby. It is the passage through which the baby will come out. So it is very important that we should know about it.